The unfortunate truth is that every one of us either knows someone or is someone who struggles with their weight. Obesity is recognized by the medical community as a disease state, and there is no arguing that it has become an epidemic in this country. Obesity is the gateway to all chronic medical disease, including diabetes, hypertension, high cholesterol, coronary artery disease, and certain cancers. The list goes on. There are countless diets and weight loss programs available today, but many fall flat on delivering safe, effective, and long-lasting results. Prevea Health is proud to offer a program that does just that. It's called Ideal Way. Ideal Way is a medically supervised, low-calorie, low-fat, protein-rich, ketogenic, and partial meal replacement diet. Ideal Way can be for anyone. It can help someone who just wants to lose a few pounds, or it can help someone who needs to undergo extreme weight loss. Before explaining how Ideal Way works, let's explain the root problem regarding the obesity epidemic. The main culprit is sugar. It's not just sugar from so-called bad carbs like candy and soda. All carbohydrates, good, bad, or otherwise, become sugar in the body. That includes good carbs like fruit, slow carbs like whole grains, and fast carbs like flour and pasta. This doesn't mean that sugar and carbohydrates are bad. Rather, we are getting too much of them. Did you know that in 2013, the average American consumed almost 200 pounds of sugar? That's half a pound of sugar per day. Our bodies like sugar. It's our preferred fuel source. But when we consume more than we burn, our bodies need to store the excess somewhere, and it's stored in the form of fat. Sugar does something else. It triggers the pancreas to release a hormone called insulin. Insulin is a powerful hormone responsible for a lot of things. Most people know that insulin lowers blood sugar. What most people probably don't know is that insulin is also the hormone responsible for storing sugar in the form of fat. When we eat carbohydrates, our blood sugar goes up, the pancreas secretes insulin, and blood sugar comes back down to normal. This is healthy as long as we are consuming an appropriate amount of carbohydrates. Unfortunately, this is not the case in the standard American diet. Remember, the average American is consuming half a pound of sugar per day. This means the standard American pancreas is secreting excessive amounts of insulin. Over time, this chronic overproduction of insulin causes all sorts of problems, something we call metabolic syndrome. Metabolic syndrome, or insulin overproduction, causes high blood sugar, high blood pressure, cholesterol abnormalities, and directly contributes to abdominal obesity. In order to effectively treat obesity, we need to treat metabolic syndrome by lowering insulin. That is exactly what Ideal Way is designed to do, and it has a proven track record of getting people down and often off of many medications, specifically blood sugar, blood pressure, and cholesterol medications. Here's how weight is lost on the Ideal Way program. Our bodies have three sources of energy: glucose, muscle, and fat. Our bodies like to burn glucose or carbohydrates first, as they are the easiest to burn. The average person has enough glucose or sugar stored in their body to fast for about 24 hours. Once we've burned through that stored sugar, the body has a fascinating way of generating an alternate fuel source. It's called ketosis or ketogenesis. This is a process by which the liver breaks down the fat and muscle to make something called ketone bodies. We can use those ketone bodies for energy when there is no glucose around. This is how we burn fat. Ideal Way is designed to put a person into ketosis by restricting carbohydrates and fat from their diet and adding adequate protein to their diet. Protein is crucial as it helps to maintain muscle mass and drive metabolism. So what can someone on the Ideal Way program eat? Most participants eat 3 meal replacement products per day, in addition to some of their own foods, specifically 4 cups of vegetables, 2 large salads, an 8-ounce serving of lean protein of their choice, specific vitamins and supplements, and plenty of water. The meal replacement component of the diet comes from a variety of products called Ideal Protein. Ideal Protein makes more than 70 different products, including comfort food favorites like pancakes, oatmeal, chili, pasta, bars, chips, and shakes. There are also gluten and lactose-free products available. Ideal protein products are made from highly bioavailable protein isolates, which are easily absorbed by the gut. This allows for enough protein in the body, without the fat and carbohydrates typically associated with proteins found in nature. There are many advantages to Ideal Whey when compared to other weight loss strategies. Our participants aren't hungry, they sleep great, and have lots of energy. It's important to note that there is a beginning and end to Ideal Whey. It does not go on for eternity. Women lose on average 2 to 3 pounds per week. Men lose on average 4 to 5 pounds per week. Depending on how much weight someone is interested in losing, they can gauge with relative certainty how long their weight loss will take. More than 1,800 people have participated in Prevea Health's Ideal Whey program. Many have lost 60, 70, 80, and 90 pounds. Some have even lost more than 100 pounds. This is a medically supervised program. To get started, we ask people to fill out an extensive health profile, which is reviewed by a medical provider. This is required for admission into the program. Our office does daily phone follow-ups the first week. Then, we see people in the office every week for weight checks and measurements until they have reached their goal weight. Once participants meet their goal weight, we transition them into a long-term maintenance program. Along the way, we educate and support participants on what is the hardest part of managing obesity: keeping the weight off. Ideal Whey is not a magic wand. No diet is a vaccine against obesity. But this program has proven to be an incredibly powerful tool that allows us to work together with motivated patients to not only get them looking better on the outside, but more importantly, healthier on the inside. We invite you to learn more about Ideal Whey at prevea.com/idealwhey.